Welcome back. Ebola affecting healthcare workers and enterovirus D68 impacting our children. It's obvious we need prevention and action plans in both our schools and our medical facilities. Joining us now are Galloway Township School Superintendent Dr. Annette Giaquinto and Chief Safety Officer for AtlantiCare, Debra Fox. Thank you so much for joining us.
Thank you.
Debra, first let's start with you. What are some of the protocols that AtlantiCare has in place for Ebola and other infectious diseases?
Well, the CDC, the Center for Disease Control, is our resource for protocols around the treatment and management of infectious diseases. So we have used them as our resource for our protocols, and an example of some of those protocols includes a screening process throughout our health system at our more than 70 sites where we can screen patients that might be entering our facilities for the signs and symptoms of a potential Ebola virus infection. We also have protocols for our employees around the safe use of personal protective equipment, which is required when managing patients who are suspected of having an Ebola infection or patients that are actually diagnosed with having an Ebola infection.
CDC just put out some new guidelines recently, and are they basically a little more stringent? Is that what it is? Or?
So the CDC is learning as everybody else is learning, and I think that based on the experiences of the Emory University and the University of Nebraska and even at Dallas, they have perfected their guidelines around the use of personal protective equipment. So I believe that the guidelines that they have now are very effective to protect our healthcare workers in treating these patients.
And do you have special isolation areas if need be?
Yes, we do. Our emergency departments are equipped with special isolation rooms that are negative pressure, where these patients will be placed should they be suspected of having an Ebola infection. And there are special protocols and procedures for our healthcare workers to utilize and follow in treating patients there. So, for example, making sure that they wear the appropriate personal protective equipment in the rooms, and then making sure that they are safely removing them under the observation of a colleague and a coworker who is actually there to watch them and to provide support to make sure that they're practicing safely in that environment.
Well, that's good to know, because a lot of people's mind at ease to hear that. And Annette, in our schools, of course, we're all concerned about our children and their health. You have 6 schools under your jurisdiction. What are you doing there to, I'm sure you do this every year, but especially this year, what are you doing to help keep our kids safe?
Robin, you are correct. There are certain protocols that are always in place, whether it's training our school nurses do for the staff, whether it's reminders we give to the students. But of course, with everything going on and so much information in the media, we're fortunate that we get the updates from the Atlanta County Department of Health. I've actually spoken to Pat Diamond on the phone. So we are upping every measure, and part of it is a facilities issue in terms of additional cleaning that is happening, the use of certain products that are designed to kill germs. Part of it is from the daily work in the classroom, of reminding children the repeated hand washing. Part of it is the signage we have posted in the schools, and I'll share a quick example. Parent brought up water fountains, and that a lot of young children in particular put their mouth on the water fountain. The response to that within actually less than 24 hours was twofold. The facilities department checking all the water fountains to make sure they bubble high enough, because when the pressure's low, that's sometimes why the children do that. Secondly, we designed this poster to add to the posters provided by the county health department, and reminders.
Germ-free zone, in case
germ-free zone. Keep your mouth off the water fountain. And so it's really a team effort at the school district and in each and every school.
If a child does get sick and it's suspected that it's something like enterovirus D68, what do you advise a parent if they're considering not sending their child to school? I guess it's an individual choice, I would imagine.
It is, but there's also certain guidelines, and our school nurses are very active in communication with parents. So really, the guidance to parents isn't very much different than it has been. If your child has a fever, if your child has excessive coughing, if your child is vomiting, all those signs, you need to keep your child home.
I know you cannot go to your school with a fever.
No, that's one of the rules. And, I will tell you, in a world with so many working parents, sometimes if a child isn't that sick, the parent does send them in. And the next thing you know, they're in the nurse's office, and then the nurse is on the phone to the parent. And we realize it is a balance for families. That school is the safe place when parents are at work. But we also have that responsibility, not just to that individual child, but to all the other children.
What age kids are in your school system, from little kids to
yes,
middle
we
school?
have one small preschool, so they are as young as 3 years old, and certainly the precautions at that school are higher because the staff members there are involved in helping children with toileting. Some of the children may still be in diapers. We have a lot of special needs kids at that site. Then at our elementary schools, we have kindergarten through 6th grade, so you're talking as young as 5 years old through approximately the age of 12, and then we have our one middle school. And how we handle that also varies. You have to give reminders to students throughout the day, and different reminders in different settings.
Sure, of course, for different age groups. And we've talked about Ebola, we've talked about enterovirus D68, we've learned how we can get both of those, but the flu kills more people than any of those in our country, and I know that AtlantiCare is making a huge push, especially this year, to get vaccinated. And tell us a little, we touched on it, but tell us a little more about it.
Yeah, AtlantiCare for many years has been a proponent and has encouraged their staff to protect themselves and get the flu vaccine. So this year, again, we have a very strong campaign around vaccination for our employees. Our employees that are vaccinated are wearing these, I believe, and protecting you, and indicates that we've been vaccinated by the flu. But I think as addition to the flu vaccine, there are some basic things that are important for our staff and our community to remember, and one of them is about staying home if you're sick. We tell that to our employees as well. We feel as healthcare workers, very dedicated and want to come to work and care for our patients and not let our coworkers down. But when we're sick, we need to take care of ourselves and stay home. And that's also protecting our coworkers. And things like we've talked about, washing your hands, doing that multiple times during the day, and making sure that we have effective hand washing procedures. Like you said, singing happy birthday twice is perfect. And basics like covering your cough and your sneezes are also very important.
So many of those things are so simple, and yet for some reason, I don't know why, people just don't always do them. But we can really keep ourselves healthy if we just take some of those measures. And I want to ask you about healthcare workers. Do you find when there's all this news about Ebola and do they get a little more concerned? Do you find that, or do you feel that you have enough protocols in place that they're okay with what's going on?
Well, I think both. Actually, I feel very confident that we have the protocols in place to keep our employees safe. But certainly there has been so much in the media, and especially when it hit the healthcare community and we first heard of the nurse that was infected by Ebola, that really created some level of anxiety with our staff. But we have a very strong communication plan in place. We're doing town hall meetings where we're providing information and allowing enough time, to get questions from the staff.
Well, some good information from both of you, keeping our schools safe, keeping our medical community safe, and we thank you so much for joining us today. And thank you to all of our guests. That's our show. We appreciate you joining us, learning a little bit more about some of these infectious diseases, and hopefully that you will help to keep yourself safe and your family safe. We appreciate you joining us. For Forum 40, I'm Robin Stoloff. Thank you for being here.